Okay, let's unpack this. Did you know the U.S. healthcare market is projected to hit an incredible $6.1 trillion by 2028?
6.1 trillion.
Yeah, it's not just a big number. It's the largest, most complex, and maybe one of the most challenging healthcare markets anywhere.
Absolutely.
So today we're taking a deep dive into the core components and strategic shifts within U.S. healthcare, specifically focusing on this massive but kind of surprisingly underpenetrated opportunity in business process outsourcing, BPO.
And what's really striking, about this colossal market is how little of its core operations are actually outsourced right now.
Right.
Barely 20% of operational spending, which leads us to ask, what forces are accelerating this shift towards outsourcing? And, who are the key innovators stepping up to meet this huge unmet need?
Yeah, good questions. We've gathered insights from a recent thematic report, which is sort of our map for this. It guides us through the complexities, and it really spotlights two fascinating companies at the forefront, Sagility and IKS.
Mm-hmm.
You'll walk away from this deep dive understanding why a seemingly niche industry, like something often seen as just back office stuff, is actually poised to reshape the very economics of healthcare. It reveals where real value is being created in maybe unexpected places.
Definitely.
So let's start with the big picture.
Yeah.
This isn't just any industry, it's a behemoth, right?
Oh, absolutely.
It accounted for, 17.1% of U.S. nominal GDP in 2023. Growing to $4.7 trillion.
17% of GDP. Just think about that.
And astonishingly, the U.S. leads globally in per capita healthcare spending. It came in at around $14,570 back in 2023.
Which is significantly higher than other developed nations.
Way higher.
And to really grasp the scale, you need to understand its foundational pillars. The U.S. healthcare market basically has two key components.
Yep.
You've got the healthcare payers. These are organizations like insurers, including the big government plans like Medicaid, over 78 million enrolled there.
78 million.
And Medicare, over 66 million enrolled, plus all the commercial plans, of course.
Right.
And then you have the healthcare providers. These are the people and institutions actually delivering the care. Hospitals, physician groups, labs, that sort of thing.
Got it. Payers and providers. But with all that spending, why are so many of these entities looking outside for help? Why outsource?
That's the crucial question.
The report points to several really powerful tailwinds pushing this transformation. We're talking rising administrative costs, which we'll dig into.
Mm-hmm.
Our rapidly aging population, the 65-plus group, is projected to hit almost 27% by 2025.
26.7%, yeah. A huge demographic shift.
And the widespread prevalence of chronic diseases, affecting 70% of Americans, apparently, and accounting for 75% of the costs.
70%? 75% of costs? That's massive.
Plus persistent talent shortages across the whole sector.
Right. All these factors create immense pressure. And this, it really begs the question of efficiency, doesn't it?
It does.
The U.S. spends significantly more on healthcare than comparable wealthy countries, but often gets, worse health outcomes.
Yeah, that's the paradox.
And a major driver of this spending gap, administrative costs. It's kind of the hidden burden.
How big a burden are we talking?
Okay, get this. In 2021, the U.S. spent an incredible $925 per person just on health administration.
$925?
Yeah.
Just on admin?
Per person, yeah. Compare that to an average of just $245 in peer countries.
Wow.
That's a difference of $680 per person. And that difference makes up 12% of the total spending gap between the U.S. and its peers.
12% just from administration.
Exactly. It's a huge, huge hidden cost that outsourcing is uniquely positioned to tackle.
Okay, 12% is staggering. So if outsourcing is the answer or part of it, what specifically are these companies doing to chip away at that bloat? Who's stepping in?
Right. So our deep dive focuses on two specialized healthcare BPO firms that the report highlights, Sagility and IKS.
Sagility and IKS.
And they're both leveraging really deep domain expertise to capture market share in this space.
What's the main difference between them?
Well, one key differentiator is their distinct market positioning. Sagility is primarily a payer-centric player. They serve the big insurance companies and pharmacy benefit managers, PBMs.
Right, the ones managing drug benefits.
Exactly. IKS, on the other hand, is more of a platform-led player focused on the provider segment.
So doctors, hospitals?
Yeah, specifically helping physicians with their non-clinical operations.
Okay, let's unpack IKS first then. Provider side. What are they doing?
So IKS is all about enabling physicians to focus on patient care, right? By handling the non-clinical chores.
The stuff doctors hate doing, basically.
Pretty much. Things across the revenue cycle, that's everything from patient registration, claims submission, billing, collections,
Mhm.
also documentation, and importantly, value-based care support, helping providers succeed in models where they get paid for outcomes, not just volume.
Imagine giving doctors back, what, 30 to 50% of their time. The report mentioned that.
Yeah, that's their goal. It sounds like a game changer for physician burnout and, maybe even patient access.
Huge impact. What's the market opportunity look like for them?
Well, if we place this in broader context, IKS operates in a massive market, over $225 billion total addressable market, or TAM.
$25 billion just for provider admin.
Just within the provider segment's administrative expenses, yeah. And currently, only about 15.6% of that is outsourced.
Only 15%.
Right? It amounts to roughly $35 billion today. So IKS, even though they have less than 1% market share currently,
90 share.
they have enormous headroom for growth. Projections suggest that outsourced market could swell to $55 billion by fiscal year 2028.
55 billion. Okay, huge potential. Now, you said they're platform-led.
Yeah.
What does that mean exactly?
Yeah, this is where IKS really differentiates itself. They aren't just a point solution vendor, offering only one service like medical transcription.
Right.
Instead, they've built this comprehensive care enablement platform, and it has 16 integrated services.
16.
Yeah, so it means they can manage everything from patient intake right through to complex billing and analytics. They act as a true strategic partner, not just a tool provider.
That makes sense. A holistic approach.
Exactly.
So how are they growing? How are they expanding their reach?
Well, it leads us to ask about their strategy, right? They have a strong land and expand approach. Once they get in with a client, they aim to offer more services.
Makes sense.
And they've been quite active with strategic moves, M&A especially. For instance, their acquisition of Acuity back in October 2023,
Equity, okay.
that significantly boosted their inpatient capabilities, like inside hospitals, and added over 450 enterprise clients.
450 clients. Wow.
Yeah, even if it meant some initial margin dilution, it was a big strategic move.
Right. Investing for growth.
Exactly. And they've also entered this really unique 15-year full platform deal with Palomar Health.
15 years. That's a long contract.
It is, and it includes a $16.5 million guaranteed upside with a gain share model.
Meaning they share in the savings or improvements.
Precisely. They directly share in the financial benefits achieved by Palomar using their platform. It aligns incentives.
Interesting. Any other moves?
Yeah, one more, an investment in WWMG, the Western Washington Medical Group.
Okay.
Through that, they're now co-owning a management services organization, an MSO. The idea is to accelerate the adoption of their platform within that group and potentially replicate that model.
So they're getting really embedded. What about technology? AI is everywhere. Are they using it?
Oh, definitely. They're not shying away from cutting-edge tech. IKS is actively embedding generative AI across 7 to 8 key use cases within their platform.
Like what?
Think about tools like Scribble now. It uses ambient listening during a patient visit to help with transcription and note-taking.
So the doctor doesn't have to type as much.
Exactly. Or things like autonomous medical coding, where AI suggests or even completes the billing codes.
What kind of results are they seeing?
They're reporting pretty significant efficiency gains, around 20–35% across the board.
20 to 35%.
Yeah, and in some specific areas like clinical documentation, they're seeing gains up to 70–85%.
70 to 85%. That's huge.
It is. It's really driving a shift from, purely human-led work to more tech-led execution. It's not just automating old tasks, but really rethinking how the work gets done.
Fundamentally changing workflows. Okay, that's IKS on the provider side.
Yeah.
Let's shift focus now to Sagility, the payer-centric player.
Right. Sagility, they're navigating the complexities of health insurance operations.
Yeah, they've been around a while.
Yeah, over 24 years of operational experience. They serve 6 of the top 10 U.S. insurers.
6 of the top 10, that's major penetration.
And 3 of the top 6 pharmacy benefit managers, the PBMs we mentioned.
Yeah, big players on the insurance side.
Definitely. And one intriguing aspect here is that winning new clients on the payer side is inherently challenging.
Why is that?
Well, because of the critical nature of the services, right? We're talking claims processing, member enrollment, customer service, things insurers cannot afford to get wrong.
High stakes.
Very high stakes. And it requires deep, deep domain expertise. So Sagility has built these really strong competitive moats because clients are extremely cautious about outsourcing these core day-to-day operations.
So once they're in, they tend to stay.
Exactly. It makes their long-standing client relationships incredibly sticky. Their top 5 clients have been with them for over 17 years on average.
17 years?
Yeah, they're hard to replace. It's not just caution. Sagility's deep integration turns their services into an indispensable, almost inseparable part of their clients' core operations.
Wow. Okay, so how does Sagility grow then? If it's hard to win new big clients, are they using M&A like IKS?
Yes, M&A is a key growth lever for them too, but maybe with a slightly different focus.
Oh, so?
They seem to target acquisitions for 2 main reasons. One, to build new capabilities, like their acquisition of Devlin Consulting, Inc., which was focused on payment integrity services, making sure claims are paid correctly.
Adding a new service line.
Right. Or 2, to expand their client base, especially into the underpenetrated mid-market payer segment.
Yeah.
Smaller insurers, maybe regional ones.
Okay, so what are some key acquisitions they've made recently?
Well, this leads us to ask about their strategic moves, right? Their acquisition of Birch AI in March 2024 is interesting.
Birch AI, what did that bring?
Cloud-based Gen AI capabilities,
Hmm.
specifically for things like real-time customer support automation and fraud detection.
AI for fraud detection. That sounds powerful.
Imagine AI instantly flagging suspicious claim patterns while an agent is still on the call. It's a powerful layer of security and efficiency.
Yeah, I can see that. Any others?
And then later in 2024, they acquired BroadPath Healthcare Solutions.
Bad.
That one was funded entirely through internal cash, which is notable. It gave them access to over 30 mid-market clients hitting that expansion goal.
Okay.
And it also brought a proprietary remote work platform called Beehive. Sagility is now integrating Beehive across their global operations to boost efficiency, especially with work-from-home models.
Interesting. So they're also heavily into Gen AI, like IKS.
Yes, but they frame its impact maybe a bit differently. They talk less about just, reducing call center headcount
Yeah.
and more about end-to-end process enhancement. How can AI make the whole workflow better?
So augmenting humans rather than just replacing.
Exactly. They're piloting automation for maybe 15–20% of interactions. But a big focus is on augmenting human productivity.
How?
Leveraging Gen AI for things like faster knowledge retrieval for agents, real-time call summarization so agents don't have to type notes later, and even providing decision support during live interactions.
So the AI is like a co-pilot for the agent.
Sort of, yeah. It's about reshaping how work is done without compromising service quality, making the human interaction better, smarter, faster.
Okay, that makes sense. So we have these two big players, IKS and Sagility, tackling different parts of the market with sophisticated platforms and AI.
Yeah.
But what about the bigger picture, the whole healthcare environment they operate in?
Right, stepping back. This fits into the broader context. And the U.S. healthcare market is, as you know, highly sensitive to regulatory changes.
Always changing, yeah.
For example, our sources point to the potential expiration of enhanced premium tax credits. Those are the subsidies that help people afford insurance on the marketplaces.
Okay, what happens if those expire?
Well, the projection is that millions could lose coverage, and the remaining insured population could become sicker and costlier on average, which would likely push premiums higher for everyone else.
Not good. Any other big policy changes mentioned?
Additionally, yeah, there are recent policy changes, specifically a major legislative package enacted in July 2025. Some circles refer to it as the One Big Beautiful Bill.
Okay, what's in it?
Well, according to our sources, it includes significant Medicaid spending cuts and new work requirements for Medicaid recipients.
Work requirements, those are always controversial.
They are, and our sources indicate that these administrative rules, if they're fully implemented, could result in millions losing Medicaid coverage and potentially put hundreds of rural hospitals, which often rely heavily on Medicaid payments, at risk of closure.
Hundreds of rural hospitals.
Wow.
Yeah.
And we want to be really clear here. Our sources are simply outlining the content of these policies and their projected impacts based on analysis. We're not endorsing any viewpoint, just reporting what the analysis suggests.
Understood. So what does all this regulatory uncertainty and potential disruption mean for companies like IKS and Sagility? Are there risks?
Oh, absolutely. While the opportunities are vast, they're definitely not without risks.
Like what?
Well, both face significant regulatory compliance risks. Non-compliance in healthcare can severely impact their business, huge fines, loss of reputation.
Right, you have to follow the rules precisely.
Exactly. There's also competition risk. Other BPO players, maybe larger generic ones or other specialists, could expand their capabilities, perhaps through acquisitions, and try to muscle in. And of course, there's always execution risk, especially for IKS with these big new strategic contracts like the Palomar deal or the WWMG partnership. Those are complex undertakings and they need to deliver.
Delivering on those big promises.
Right.
But despite those challenges, what's the overall outlook?
Despite the challenges, the overarching trend toward outsourcing in U.S. healthcare seems really strong. It feels undeniable, actually.
Why so strong?
Well, the structural drivers we talked about aren't going away, are they? The aging population, rising chronic illnesses, the ongoing administrative complexities, they all create this persistent structural need for the specialized services these companies offer.
So the demand is baked in, essentially.
Pretty much. Both IKS and Sagility, with their deep domain expertise, their tech-led platforms, and these strategic growth initiatives, they seem well positioned for long-term growth in what is still fundamentally a structurally underpenetrated market.
Yeah, what really strikes me from this deep dive is how these companies aren't just, processing transactions or selling a simple service. They're becoming deeply integrated partners in this incredibly complex system.
That's a great way to put it.
They're actually helping to solve some of healthcare's biggest challenges, aren't
Yeah.
they? From that administrative bloat we talked about
Yeah,
to maybe even helping with physician burnout.
indeed. And if we zoom out again, it really highlights how specialized knowledge combined with scalable technology like AI is just key. It's key to unlocking efficiency and value in a market that absolutely desperately needs it.
So what does this all mean for you listening? Well, it means that behind the scenes of your next doctor's visit or when you deal with your insurance claim, there's this fascinating world of innovation and strategic partnerships working tirelessly, working to make the system hopefully maybe just a little more streamlined, a bit more efficient.
And this leads us to a final thought, perhaps something for you to consider. As this digital transformation deepens in healthcare, will the focus shift even more towards outcome-based models?
You mean for the BPO providers too?
Yeah, where BPO providers like IKS and Sagility are not just paid for performing tasks, but actually paid for delivering tangible improvement.
Like improvements in patient care metrics or proven cost reductions?
Exactly. Will their contracts increasingly tie their success directly to the health outcomes and financial health of their clients?
That's a really interesting thought to mull over as the future of healthcare continues its rapid and sometimes bewildering evolution.
Indeed.
Well, that's all the time we have for this deep dive. Thanks for joining us.